what am I doing that is special and or different? I think that I have an interesting story in that I spent the 5 years prior to medical school working as a social worker. And that gave me an interest in community-based health. And so as a medical student, as I transitioned to medical school, I have a special interest in primary care, community-based primary care specifically, but also palliative care and issues around helping patients through complicated end-of-life decisions. Hi, my name is Jonathon Giftos. I'm a fourth-year medical student at Mount Sinai School of Medicine. Medicine is important to me because it provides me an opportunity to have meaningful relationships with people in the community in which I live. And through those relationships, I believe we get a real insight into their lives, into their joys, into their struggles, and through gaining a better understanding of their struggles, we are able to do our best to support them through those challenging times. We, as physicians, are often given great privilege to witness patients at their most vulnerable times, times when illness or poverty or social inequality has taken dignity from them. And I think that we have an opportunity as physicians to restore some of that dignity through compassionate care. So I'm very interested in palliative care, and that interest has been slowly growing over the course of my time as a medical student. And it began because I saw just how complicated the medical system and medical care has become over the years. As technology becomes more advanced, and as we have more advanced therapeutics for patients, the choices that they need to make towards the end of their life become more complicated. And I've learned that that it's really important to have somebody there that can bring care back to the patient, that can bring decision making to the patient and facilitate their decisions at times when they're faced with very complicated choices. Mount Sinai is a very special place. It has a very unique location that allows it to serve a really diverse patient population, and that was very important to me. It also has a long history of a dedication to both the art and the science of medicine. It brings a humanistic approach to patient care to everything that it does. I think that that is evidenced by the fact that it has, for example, the first and largest department of palliative care in the country. And with its focus on patient-centered care, with its focus on compassionate relief of symptoms and guidance through end-of-life care, and the fact that we as students get exposure to that from the very beginning, I think that makes Sinai very, very special.